Hello, everyone. Last class, we have studied beta-lactamase, and we have known beta-lactamase includes penicillins and cephalosporins. Penicillins also includes narrow spectrum penicillin, natural penicillin, penicillin G, and also includes semi-synthetic penicillins, such as acid-stable penicillin, penicillin V, and penicillinase-resistant penicillins, and broad-spectrum penicillins, and anti-pseudomonas penicillin. The second kind, cephalosporins, divided into 4 generations. The first generation cephalosporins mainly kill positive bacteria, show clinical using very easy, used to treat gram-positive infections. The second generation cephalosporins mainly kill positive and negative bacteria, so in clinic, used to treat mixed infections. The third generation cephalosporins mainly kill gram-negative bacteria, so in clinic, used to treat serious infection, such as serious negative bacterial infection. The fourth generation cephalosporins, the highest, the most powerful, but it is the last kind of drugs we couldn't use as the first choice. Okay. This class, we will continue our class, study the antibiotics. And this class, we will study macrolidins, clindamycin, and vancomycin. Okay, so the first kind, macrolidins. Macrolidins, these drugs have basic group structures. These drugs have macrocyclic lactone ring. For example, the prototypical agent is erythromycin. So we call macrolidins. Another name is erythromycins. This year, we also used semi-synthetic erythromycins. For example, clarithromycin, azithromycin. And azithromycin is the only agent have 14 macrocyclic lactone ring. And it is the most widely used drug in erythromycins in macrolidins in clinic. Azithromycin. And these drugs, do you remember in penicillin, I have told you, in China, we call penicillin 青霉素. And cephalosporins means 头孢霉素. So do you know the Chinese name of erythromycin means the 红霉素? Yes, very good, 霉素. We call antibiotics, they are mycin, 霉素. So that means azithromycin, the Chinese name is 阿奇霉素. Because these drugs, especially azithromycin, is the most widely used agent in clinic to treat some infections. Later we will explain. So in this part, the prototypical agent is erythromycin, 红霉素. But in clinic, the most widely used drug in this kind is this one, azithromycin, 阿奇霉素. Okay. These drugs, macrolidins or erythromycins, they share the same mechanism. Do you remember the mechanism? In the beginning of this part, we have studied we divide antibiotics into 5 kinds in accord with their mechanism. And some drugs can inhibit protein synthesis. Yes, erythromycins Macrolidins can inhibit protein synthesis by binding to 50 subunit ribosomal, so inhibit bacterial growth. And the antimicrobial activity of erythromycins, of macrolidins. So that means macrolidins, the pharmacological effects. Before we study the pharmacological effects, we can use two words to explain its pharmacological effects. The first word is narrow spectrum. You have studied what's the meaning narrow spectrum. Means the only arrest limited group. The second word is bacteriostatic agents. What's the meaning bacteriostatic agent? We also studied means only arrest, only inhibit bacterial growth, couldn't kill bacteria. So let's study erythromycins, narrow spectrum, bacteriostatic agents, macrolidins. The first pharmacological effects can inhibit aerobic gram-positive cocci and bacilli, such as pneumococci, streptococci, Clostridium perfringens, and Corynebacteria difficile, gram-positive cocci and bacilli, similar to penicillin. And also can inhibit gram-negative organisms such as Bordetella pertussis, Brucella, and Legionella. And then also can inhibit these bacteria, Chlamydia, Mycoplasma, and Rickettsia. So for this reason, in clinic, especially chlamydia and mycoplasma infection, the first choice agent should be macrolidins, erythromycins, and also can inhibit some anaerobic bacteria. So let's study the clinical using of erythromycins. The therapeutic applications of erythromycin is a penicillin substitute in penicillin allergic persons, or infections caused by Staphylococcus aureus that are penicillin resistant. So the first clinical using of erythromycins means the patients couldn't use penicillins and then they use erythromycin because they have the first same antimicrobial activity, gram-positive cocci and bacilli. So the first clinical using of erythromycin means as the penicillin substitute. And then we also use erythromycins to treat mycoplasma infection and Legionella infection and chlamydia infections as the first choice. So here we confirmed this. Mycoplasma infection, chlamydia infection, the first choice agent is erythromycins. In erythromycins, this year, the most widely used drug is azithromycin. So, which one? The question is, which drug is the first choice agent to treat chlamydia infections or mycoplasma pneumonia? You should know the first choice kind of drug should be macrolidins, erythromycins. The first choice drug is azithromycin. Understand? Okay. So clinical using, that's now we studied. And then erythromycins, the other section of erythromycins. The first adverse reaction is the gastrointestinal reactions. Gastrointestinal reactions, the patients use the drug, feel upset, stomach, maybe induce gastric ulcer. And it is the very, very common adverse reactions of macrolides. So if you have the experience, if you have used the macrolides, erythromycin, azithromycin, clarithromycin, and you have the experience, stimulator will have the gastrointestinal irritation. So, for example, our patients, they use penicillin, intravenous using penicillin, and 100 milliliter. The patients should inject the drugs in 30 minutes. But do you know, if our patients use azithromycin, erythromycin, because this very, very commonly adult section, so only 100 milliliter erythromycin, azithromycin, the patient should intravenous using at least in 4 to 6 hours because the common adult section, gastro irritation. And if someone, I feel the intravenous is too slow, so the patients regulate the injection velocity, and then maybe in several minutes they feel stomach, so they should regulate the injection velocity again, slowly intravenous using, because it's gastrointestinal irritation. And the patients shouldn't, if they want to use the drug, they must have the meal, couldn't empty stomach, because this adult section very commonly. Okay. Next adult section is the hepatic toxicity. Hepatic toxicity. Do you remember last class in the first generation cephalosporins? I have told you in clinic, 3 kinds of drugs have obviously nephrotoxicity. They are the first generation cephalosporins and vancomycin and aminoglycosides. And here we study erythromycins have hepatic toxicity. So I want you remember, in clinic, 4 kinds of drugs have obviously hepatic toxicity. They are the first one, erythromycins, means macrolidins, and the second one is tetracyclines. And the number 4 is rifampicin. The last one, lincomycin. So you should remember these 4 kinds of drugs. These drugs have obviously hepatic toxicity. Have obviously hepatic toxicity. What's the meaning? That means we should pay attention to 2 points. The first point, if our patients use the drugs, if the elderly patients or hepatic function abnormal patients, we couldn't give these 4 kinds of drugs. The first point. The second point, our patients, if they use these 4 kinds of drugs, erythromycin, tetracyclines, lincomycin, and rifampicin, they couldn't long-term use, and they couldn't co-administrated with them each other. Understand? Because these 4 kinds of drugs have obviously hepatic toxicity. Okay. Next adult section of macrolides is the thrombophlebitis caused by intravenous injection. Okay. The most commonly adult section are gastrointestinal irritation and hepatic toxicity. Macrolides, except just now we use erythromycin as the prototypical agents, explained these drugs' pharmacological effects, clinical using, and idle sections. Except erythromycin, in macroleadings, we also use some other drugs. So let's explain these drugs further. This drug is clarithromycin, 克拉美素. Clarithromycin its antibacterial activity is higher than erythromycin and lower adult fractions than erythromycin. So, clarithromycin we always oral administration to treat just now explain the clinical using mycoplasma infection or chlamydia infection or as a penicillin substitute. So this drug is clarithromycin oral administration. Except clarithromycin, in fact, in clinic, in macroleadings this year, in each country, the most widely used drug is this one, azithromycin, 阿奇美素. Erythromycin, yes, higher efficacy, more potent than erythromycin, lower idle section than erythromycin. So it is the most commonly used drug. The half-life, in fact, is wrong. The half-life nearly 35 to 48 hours. 35 to 48 hours. Because this the longest half-life, so the patients they can use azithromycin 1 day one time or 2 days one time because the longest half-life and the most widely used erythromycin is azithromycin this year. Okay, just now we studied azithromycin, erythromycin, and clarithromycin. Except these drugs, in fact, in clinic, we also use another two drugs. They are clindamycin, 科林美素, and lincomycin, 林可美素. Yes, excellent, 林可美素. And these two drugs, their antimicrobial spectrum is similar to that of erythromycin, similar to azithromycin. These two drugs in them, clindamycin, more powerful than lincomycin. They have the same antimicrobial spectrum, similar to erythromycin. So gram-positive cocci and bacillus, some aerobic gram-negative cocci, mycoplasma, chlamydia, so similar to erythromycin. And because they have the same mechanism, the mechanism of its action same as macroleadings. So we still remember. That means clindamycin and lincomycin inhibit bacterial protein. Yes, inhibit bacterial protein synthesis, bonding to 50 subunits. Okay. Clindamycin, ADME, absorption. Absorbed completely after oral administration. So we can oral administration. Clindamycin or lincomycin. Then distribution. Can be distributed widely, especially concentration in the bone tissue is very high. So what's the meaning? That means bone tissue high concentration. So that means later we use clindamycin and lincomycin mainly used to treat bone joint tissues infection. The reason is here because these drugs, the concentration in the bone tissue is higher than other tissues. My tablets in liver, excretion in the urine or bile. Okay. Clindamycin and lincomycin can inhibit some anaerobic and gram-positive aerobic cocci and bacillus. Here is the major clinical using, mainly used to treat osteomyelitis, and as the first choice agents. Why? Just now explained the reason. Because high concentration in the bone tissue. So, which drug is the first choice agent to treatment of osteomyelitis? Myelitis, and you should know this drug, clindamycin. The idle fractions of clindamycin and lincomycin similar to erythromycin. So the very common idle fraction is gastrointestinal irritation. Except gastrointestinal irritation, also have hepatic toxicity. Just now I explained 4 kinds of drugs have obviously hepatic toxicity. Do you remember the 4 kinds of drugs? They are erythromycins, tetracyclines, rifampicin, and lincomycin. So have hepatic toxicity. Same with erythromycins. Okay. The last drug in this chapter is vancomycin. So let's study vancomycin. Vancomycin inhibits cell wall synthesis. Oh, do you remember we studied some drugs can inhibit cell wall synthesis? Which kind of drugs? Yes, penicillin and cephalosporins. So, vancomycin share the same mechanism with penicillin with cephalosporins, inhibit bacterial cell wall synthesis. Maybe means similar antibacterial activities to penicillin. And so we use 2 words to explain vancomycin. The first word, narrow spectrum. The second word is bactericidal agents. Bactericidal means the can kill bacteria. Narrow spectrum because only kill limited groups of bacteria, such as gram-positive cocci and bacillus. Also includes MRSA. Can kill gram-positive cocci and bacillus, similar to penicillin. So that's now we explained because share the same mechanism with penicillin. And also can kill MRSA. The full name is methicillin-resistant Staphylococcus aureus. Oh, I think you still remember this bacteria. Very strong, very difficult to kill. So, in clinic, vancomycin mainly used to kill MRSA infection, means the serious infections. Serious infection, super sensitivity to beta-lactamase antibiotics. So that means we have the patients. At first, we give penicillin, and then if penicillin is ineffective, we give cephalosporins. If cephalosporins 1 to 3, 4 generations ineffective, oh, we have to give the last drug. And the last antibiotic is vancomycin. So vancomycin mainly used to treat these very serious infections, such as Pseudomonas enteritis. Pseudomonas enteritis, it is one kind of super infection. Do you know why the patients have Pseudomonas enteritis? Because they long-term use broad-spectrum antibiotics, and then they have super new infections. New infection, super infection, such as Pseudomonas enteritis. And for this reason, so we have to give the last antibiotics, vancomycin, to treat. Vancomycin, just now I said, It is the last antibiotics because this drug has the worst serious adult reaction, frequently and serious, includes ototoxicity, includes nephrotoxicity. Ototoxicity, we have studied high efficacy diuretics, furosemide, and later we will study aminoglycosides. These three kinds of drugs have obviously ototoxicity. And then nephrotoxicity. Last class we have studied. Just now I also mentioned. Do you remember? Three kinds of drugs. The first kind is the first generation cephalosporins. The second of drugs are vancomycin. The third kind of drugs, later we will study aminoglycosides. So, because this frequently and serious toxicity, so vancomycin is rarely used in clinic, only used to treat these serious infections or super infection as the last urgent. Okay, this class, some questions. The first one, what are antibacterial activity and mechanism of microlidins? Very easy, only one word, protein. These drugs inhibit protein synthesis. The second one, what are the applications of macrolidins? That's now explained. As a penicillin substitute and for which kind of disease? Mycoplasma and chlamydia infection as the first choice. What are the antibacterial mechanism of clindamycin? Do you remember? Yes, protein. Vancomycin, the word is cell wall. Polymycin, do you remember? Cytoplasmic membrane, inhibit cytoplasmic membrane. Number 4. What are the complications of clindamycin? And do you remember that's now confirmed? Osteomyelitis as the first choice. Vancomycin, superinfection. What are the major adverse reactions of vancomycin? Oh, ototoxicity. Very serious, frequently ototoxicity and nephrotoxicity. Okay, this class is over. See you next time.